My name is David Maletta. I'm a partner at Colburn Hintze Maletta. We're going to talk about DUIs and how to attack the reading. We're going to talk about a blood test. How do you attack a blood test? Well, inherent in the blood test, according to the crime lab, they have a 5% margin of error. However, according to Department of Health Services, Department of Public Safety, and my expert, it's actually a 10% margin of error. In addition to that, any clotting within the sample would artificially raise your reading. Now, you need to understand they're doing a whole blood analysis. That's like orange juice with the pulp in it. Where if you went to a hospital and you asked them to do alcohol determination based on your blood, they would do a plasma analysis like orange juice without the pulp in it. So what I'm getting at is their methodology is more likely to clot, thus more likely to artificially raise your reading. So if this is a clot within the sample, it'll dissipate the alcohol out of the clot and cause the reading to be artificially higher than your body's true alcohol concentration. There's also the possibility for fermentation, or as we also call it a neogenesis argument, that after the blood was taken out of your body, that it ferments within the sample and raises the reading. And that can happen because there's food sources in there, and that can raise the reading and cause fermentation within the sample itself. And often, when I look at the blood packet that the prosecutor sends over, you can see acetone in there, which can be a byproduct of your body breaking down the alcohol, but it can also be a byproduct of fermentation. And that's a strong defense. And the longer it takes for them to test the blood, because they don't test it that night, they wait till they get 60 to 80 samples to mitigate the expenses of running the blood test. The longer it sits, the more likely there is for a possibility of fermentation to occur. And there are studies that we have and we present that document fermentation occurring within the sample. Even when they put preservative in there, it still does not preclude the possibility of fermentation. Also, you can attack the draw. So when they draw the blood, you can attack how they draw the blood. So when they draw the blood, they often use hand sanitizer. They put this on their hands, and then they grab the gloves. And the gloves are like in a tissue box. And they put the alcohol on the outside of the gloves because the main ingredient in hand sanitizer is ethanol, exactly what they're testing for. So then they feel around the vein, palpitate the site. They've cleaned the site with a non-alcohol swab, but they've got alcohol in the gloves, and they're palpitating the site, and then they put the syringe right through it, right through alcohol. Suck up the blood, and they've already gone through the alcohol in your arm. And when they suck it up, there's suction on the blood. If we have any evaporated alcohol there, it'll also catch it and can artificially raise the reading as well. If you're charged with a DUI and they say your blood is a certain level and you want to attack that, give me a call. We can get you in for a free consultation at Colburn Hintze Maletta, 602-825-2500. 602-825-2500. Speak to you soon.